vastly upgraded with our replacement by Dr. Ferrell, Dr. Kosovac. But again, we are so excited to share a lot of the things that we've learned about them over the past 7 years. This is a very special group of high-achieving, down-to-earth, kind, and caring individuals. And so while we are sad that we can't leave with you, we are so excited to share all these pictures that Lillian has forced us to take together. But first, we would like to start by highlighting the accomplishments and the successes of the department over the past academic year, focusing on 3 domains: productivity, innovation, and culture. We'll start with productivity of the department. So once again, Duke rises to the top of the Blue Ridge rankings for NIH funding. We would specifically like to highlight the contribution of the Division of Surgical Sciences to this achievement. And also note the absence of MGH, which seems to be weirdly an institution that really brings out Dr. Shaw. As Dr. Allen pointed out in his review on Wednesday, our residents remain highly productive. But not to be outdone by his own residents, Dr. Shaw also increased the size of his campus.
However, when it comes to faculty productivity, I can say no division has outdone the trauma and ACS division. So just take a minute to review that with me. Specifically, they are by far the department leader in the production of new and updated guidelines. In case this is not clear, this is spearheaded by Drs. Virginia Parker and Patrick Bordoff. By comparison, the Duke Regional ACS has produced 0 guidelines. And no biliary pathways in the past year. However, they have managed to outperform Duke University Hospital in the number of spyglass operations performed in the past academic year, as can be shown here. The large column that Dr. Fong's face next to it represents the number of spyglass procedures he has done, as he's done. In fact, this has led us to develop a new metric for determining the procedure to guideline ratio, also known as the GR. Shown here are projections for this current academic year, as well as the future.
We'd like to commend Mohammed and Glenn for continually pushing the boundaries of conventional loop use. And we would also like to recognize the hard work of Dr. Hodgman and others in celebrating the life of Papa Roach, the longtime resident of the Duke North stairwell. Duke is also the only institution that randomly assigns faculty a name for the electronic medical record. Which leads us to wonder, is Kevin actually Dr. Shaw's?
Our last topic, most importantly, is department culture. Here at Duke Surgery, we pride ourselves on cultural competency and social awareness. Shown here is the inaugural Duke Surgery Coronavirus Conference 2020, which was, this is the social one, and there's we also pride ourselves on camaraderie. As we see here, the Virginia residents in particular, and family of sorts. We also pride ourselves on our empathy. Senior residents empathize with their junior residents at every opportunity. As I know that was and possibly one of the most notable things of our program is our culture of outside excellence, where regardless of cost, we are absolutely dedicated to academic excellence every year. quality of life as a future resident. But this year we again experienced the annual and we continue to observe what some for the incoming interns, bonusing water quality may be an area to review in our efforts to decrease our social site infection rate. We continue to rely on the samples of our program director, Dr. John, who even after years of foot stomping, size, and history, continues to develop us. And interestingly, he has the same reaction at the birthday parties as us. I leave you to draw whatever conclusions you would like. As Grace leadership, we are motivated to continue to achieve excellence in all domains, and then winning the Duke UNC softball game. Like prior years, we have a few awards to give. The first is the quote intern of the year. This is an award given to the attendee who each year is deemed by the residency class to lead by example in terms of assessment, checking, chart, and every second, and texting you at all hours of the day regarding those minute details. We would like to commend Dr. Brooks for, again, being a perennial candidate for intern of the year. As shown here, she is managing to hold 2 separate phone conversations at the same time, which is traces back on interns who do well in one of our example. In fact, she has been called the Meryl Streep of the intern of the year awards. Always nominated, but winning perhaps not saying should. With that said, this year we would like to recognize another excellent connection with impeccable attention to detail. He doesn't just sign your notes, he reads them. He reads them. They're not accurate, he'll text you about it. He knows. He knows extensions are out at all times. Focus on consultancy if necessary. Dr. Arthur Burke, aka this award will be delegated to the graduating second-year resident, Liv Scheidler, to present this award of
the Dr. Shimon Gao Golden Fist Award. Thank you. It was really an honor to have this award for the last year. My name's Glenn. I'm one of the second years now. I believe this award is loosely based on a experience of Dr. Gao responding to a leveled hemorrhoid bleed and performing an act of hemostasis that somewhat resembled this award. And so it commemorates an intern who goes above and beyond the call of duty. As an intern, I thought that this award would certainly go to my co-intern, Gabe Carrillo, who he had developed a system at the VA where he had a stash of honey buns that he would use to barter consultants to come and see our patients sooner than others. But nevertheless, this award was given to me, I think partly because I had bridled myself as a way of practicing this act. I was somewhat expecting that picture to show up, and I had a feeling that would show up. Thank you, tears in my eyes. But I actually remember the award being given because of a plethora of perianal abscess incision and drainage procedures that I had done at the Duke Raleigh Hospital, an exceeding number. We had really developed a center of excellence for perianal care at the Duke Raleigh Emergency Department. But that's all old news. I would like to pass this award on finally to this year's award. Invariable positive attitude. A few notable moments for Dr. Larson. One, she became a very well-known phlebotomist, I believe, at the Veterans Affairs Hospital, sinking IVs that even the VATS team could not get on her patients. But more importantly, during the holiday block, Dr. Larson brought in, I believe, a guitar or some musical instrument and actually went room to room to her entire patient list and sang Christmas carols on the PM rounds. Much more commendable than perianal abscession. So thank you, Dr. Larson.
Miscommunication Award is given annually in honor of an anonymous resident of this program. This year we saw multiple strong submissions, most involving Dr. Vatsas, who unfortunately did not realize the edits do not actually delete the original message. I actually also realized that these edits can be seen retroactively. However, this year's award winner is recognized for communicating a critique of Dr. Vatsas directly to him. In keeping with the spirit of the award, we have kept the name of this person anonymous. And next, the Dr. Scott Institute Award for Best Eminent Comment goes to Dr. Shaw, which is extremely helpful clarification. So all in all, it's been a highly productive year in Duke surgery. Congratulations. Now let's start with recognizing each of the chiefs individually. Before I get started, I'd love to highlight one of the strongest friendships in the history of Duke surgery, the Penguins. So from intern year to research to chief leader, they have been inseparable and consistently support each other emotionally, physically, is Imran Anwar. He was voted most likely to have hypertension, and he has consistently been a groundbreaker in fashion at Duke surgery. He's cheerful, goofy, and just such a welcoming presence. So welcoming that he has tried to integrate every single one of his past girlfriends into his residence. He went so far as to integrate and invite Issa #1 to be the courthouse witness at my COVID courthouse wedding. I still don't actually know her last name. But after 7 years of hard work and perseverance, he finally managed to achieve a complete work-life integration by marrying a co-resident, Dr. Issa Delora. But despite that small shortcoming, we hope that we have already prepared his portrait for this wall. Congratulations, Dr. Cooper.
All right, well, I was going to start by thanking the MCs, but I'm debating it now if we just